Hello, and thanks so much for joining us today. I'm Carol Jenkins. The program is Black America, and with us today is Linda Villarosa, Associate Professor at CUNY's Journalism School. She also teaches at the City College of New York. Her work was included in the famous New York Times 1619 Project, and she is the author of several books. Her essay in the New York Times on Black maternal health caused a sensation in the medical world, which was an awakening for her, and her latest book, just released, Under the Skin, The Hidden Toll of Racism on American Lives and on the Health of Our Nation. And Linda, thank you so much for being with us today. As I said, we had to shorten your introduction because there are so many things. And in fact, the very good news is that you're going to be teaching at the medical school. Is this the fall semester?
Yes, I'm so excited. The medical school at CUNY is newish, and I'm glad to have the opportunity to address medical students and pre-med students.
Because this is the source of a lot of the resistance to your revelations and your work and the understanding of why we have a problem of health in Black America. You know, it is not just a figment of the imagination, it's a real thing.
And it's interesting because people talk about discrimination in our healthcare system and they think Tuskegee. So
the syphilis project.
The Tuskegee syphilis experiment.
Right.
And certainly that was terrible, but that was years ago and it mattered. But what happens to people to make them resistant to our healthcare system is what happened to them yesterday or what happened to a family member. And so there is a problem in our healthcare system that it's been difficult to both address and to find solutions for.
I love the book, and I love your personal story throughout the understanding of what we were really facing, because you were writing at Essence magazine about health, you know, and in those days, you were one of the primary espousers of pull yourself up by your bootstraps, get it together, meditate, you know, and then you realize that it's more to it than that.
I think as I learned more and more, and also went to public health school, I started learning that while eating right, exercising, taking great care of yourself, going to the doctor when you need to is all important, that's not the only thing. And putting the lens of personal responsibility on human beings without also thinking, something is wrong in our society that harms our bodies, something is wrong in the actual healthcare system, our communities have been damaged by centuries of discrimination. Without thinking about those things, the solution isn't complete by just telling people to do better.
So you tell the story of your own dad and that experience of having a man who was having some issues and being treated very badly because people thought he was, a poor Black man. And your mom called you. Tell us that story, because it's such a, I could see my family members doing the same thing. Let's dress up, let's take the bio and show these doctors that they're not, dealing, with someone less than human.
That happened about a little over 20 years ago. My father was in the hospital in Denver, where I'm from, in a veterans hospital. And my mother called me and she said, you need to come. I was in New York. You need to come and you need to dress up and you need to put your business card in your pocket. And I'll pick you up at the airport. I was also pregnant. So I was like, oh my goodness, what is happening here? I have to get on a plane like this. So I got there and I said, Mom, what's going on? What's happening with Dad? And she said, they're treating him like an N-word. That's what my mother said. So we went to the hospital, and my father, who is impeccably dressed, he's quiet, he's well educated, he studied biology in college. And so he was shackled to the bed and he was really upset. His gown was dirty, his hair was messed up. And I just looked at him and I thought, what's happened here? And I leaned in to give him a kiss and he said, get me out of here. And my mother said, we need to show the people here that your father is not just this individual Black man, that he is educated, that he served in the military. This is a veterans hospital. This is what he looked like before he got sick and got upset and got freaked out by being so ill. And what my mom said to him is, if you explain to him what's going on, he will understand and he won't be so angry. And that really worked. But what I kept thinking about, it's like, why did we have to go through that? Why were they ever treating him like that? And why did it take sort of this middle-class respectability to get them to give him the kind of care and treatment that every American and every person deserves?
So that was you, and that was 20-something years ago. But that still happens this very day in hospitals across this country, where the one instance of the woman doctor who knew that she was in trouble, and no one would pay any attention to her. Tell us her story.
So she is a white, hello. So she is a black obstetrician gynecologist who went to Stanford to college. She then went to medical school. She finished medical school. She was pregnant, and she knew something was wrong. I think she had a scheduled induction. So she was going to induce her baby, and then she felt like something was wrong. No one would listen to her, even though she was a doctor herself. So what she said was, if you do not get this baby out of me, I'm going to induce myself because I know how. And that's when, she got the care and treatment. But her baby has some delays, but the baby's fine now. But I was struck by that. Why did it take a woman gynecologist had to get so desperate in order to just be listened to?
So there is a long history, and before you leave that chair, we're going to have you talk to us about the cures. How do we fix all of this? I have a feeling having you at the medical school is part of that. But there's a long history, the Dr. Sims gynecological experiments, I guess, you would call them. The sterilization of women, of course, the Tuskegee, syphilis case. But tell us about the sterilization. I think the sisters that you encountered who had been sterilized against their will or with no knowledge of it.
So these were two sisters. They're known as the Relf sisters, Minnie Lee and Mary Alice. Mary Alice has some developmental disabilities. Minnie Lee is her older sister. So when they were 12 and 14, they were sterilized without their mother or father's informed consent. This was in Montgomery, Alabama, and it was a time when people were, the local government was trying to get black people who had come to cities like Montgomery and Birmingham to find work, trying to get them off the public assistance rolls. So the two nurses came and took the 12 and the 14-year-old to the hospital. Their mother had signed an X on the consent form. She thought they were going to get some kind of immunizations, but instead they were sterilized. So that was in 1973. They, through the help of their social worker, they made it to the Southern Poverty Law Center, and there was a lawsuit that they won. So they won the lawsuit, Ralph versus Weinberger, and it changed the history to say that you can no longer just put an X to get sterilized. But what happened to the Ralph sisters is they never got compensated. So sometimes when we talk about reparations, people are like, well, it's unclear who should get reparations. So even as we're in this public debate about reparations, to me, this seems clear. If a clinic under the auspices of the federal government has sterilized young girls against their will or without their parents' consent, and they never had children, their lives were ruined in some ways, they deserve some kind of, at minimum, an apology, at maximum, money.
So, the book is full of instances like that. You did such, terrific on-the-ground work and really keeping in touch with these patients as well. One of the things that you do so well is to clarify the whole idea of the difference between black and white health and people, and the fact that many people felt that black patients didn't need the same kind of anesthesia or medication because they were tougher, So talk to us about the real differences between, blacks and whites or anybody else.
My feeling and the growing awareness is that even though it's, certainly when you go into medical care as a black person, there you are, you're a black person, then there are white people. And so, but in the past, there's an assumption that there's something different about black bodies, and different meant inferior. So that stretches all the way back to the days of enslavement, when black bodies were abused under the idea that we had super high pain tolerance. We were given, we were forced to work in the fields under the assumption that we had low lung function, so that working in the fields built your lungs. And some of those false ideas have stretched all the way to the present. So the growing realization is that there are no kinds of differences that we should care about, except the differences that individual people have, not based on some kind of race assumptions, especially those from the past. And medical students have really been on the forefront of looking at this to say, wait a minute, why do we have these kind of stale ideas that are left over from long ago, and that's still in current medical education and practice. So I'm really excited by what's going on with medical students right now.
But you're not happy with the training that medical students have gotten generally, because generally they still are holding on to, because the cases that you present are, women saying, I need more pain medication, and being told, no, you don't, so the medical institutions themselves have perpetrated this difference, the high tolerance for pain. It was interesting that Thomas Jefferson wrote the most horrific things about black people,
Given that he had black family.
I know,
yes.
Of course, and his children, and to see the kinds of things that he wrote, again, this high tolerance for pain and the disregard for, just truly incredible. And that still has seeped through the understanding of what's going on, in hospitals. And so interesting, your story about following Dr. Freeman, Harold Freeman, at Harlem Hospital, who, as far as I'm concerned, was an angel. Talk to us about the fear element, the one patient that, that he had, that you see why many people are afraid to go to the hospital, afraid to go to the doctor, afraid to find out anything bad, because how do you handle what comes next?
It was so interesting. So I was an editor at Essence, the health editor, and I bugged Dr. Freeman until he let me shadow him. So he just stuck a white coat on me, and I was like a medical student or a very quiet person standing there observing. And I saw him, he worked at, he was a cancer doctor, and he had this patient who was a black woman. She worked in the city. I think she was some kind of administrator. And she said she went in with breast pain. So when we saw her breast, it was very misshapen, it was dark, it was advanced breast cancer. And he is, such a kind person, such a great physician. And he was very gentle with her, but he did ask her, why did it take you so long to come? And I thought it would be, she didn't have health care, or something really
Sure.
concrete. But what she said is, I was afraid. And then I thought, well, she was afraid of this scary lump. And what she had already fast forwarded to the future, and she said, I was afraid that if something happened to me, there'd be no one to take care of my son. And I just thought, that is a different level of understanding someone's humanity, and not just making these assumptions that you don't have enough money, that they're, going into the healthcare system is emotional. It's difficult, it's scary, as my personal experiences have shown. But all of us have had those, and that, what I like about sort of the changing medical education is it adds a level of compassion and empathy.
So you and I have talked a lot about Black maternal health. Your wonderful essay in the Times that just broke open a completely new understanding of how many Black mothers and babies die. Completely outrageous and unnecessarily for the most part. And again, it's not an issue of class or poverty, any of that. So, because as a good friend of mine said to me, it doesn't matter how smart your daughter is and how much education she has. You better have somebody in the hospital with her while she's having the baby, because many things can go wrong.
That is really true. And I think even when class is matched, Black women have a worse time. And the statistic that really got to me was that a Black woman with an advanced degree, so a master's degree or more, is more likely to die during childbirth than a white woman with an 8th grade education. So certainly poverty always makes everything worse and harder and adds fear and adds stress. But even when that isn't present, it's a problem. And when I was writing that story about maternal and infant mortality, Serena Williams was going through what turned out to be a very difficult birth, even though she had legitimate concerns that were ignored. I'm glad her baby is super cute. I see her on Instagram all the time,
right, and
fine, but no one should have to go through that.
So talk to us about the solutions now, because that we know that we've got, so two things that we know. It's not an imaginary thing. Black people should not have to pull themselves up by their bootstraps to get healthy. There is a problem in the medical system. So how do we deal with that?
Well, I think the two things that I have really thought about deeply are whenever I do a story, there's a patient navigator or a doula or some kind person who isn't necessarily the physician, and who doesn't necessarily have all the education and high-tech equipment, but is the caring person. So even though we have arguably the most expensive healthcare in the world, and certainly the best and most technologically advanced, we can't doctor our way out of some of the problems that we have, and we need caring people with us, whether it's a family member, whether it's a doula, a patient navigator, a social worker sometimes, to put the care back in healthcare, because all the technology isn't making our country as a whole healthier. The other thing is, I think we really have to support medical students who are, I've seen medical students who've been awakened by Black Lives Matter, even if they're not Black, who are very political, who are very progressive, who are trying to make a difference while going to medical school. That alone is difficult. So they need support. And some of the, medical, certainly in the last 2 years, you've seen medical organizations and certainly agencies change and create health equity centers at colleges and things like that. So I think there's change afoot, but that's the change we have to support.
And Governor Cuomo used your essay to, implement the doula program. Tell us about that.
I was so happy about that, and just to say that doulas deserve to get paid. So the doula in my maternal and infant mortality story made just a few $100s for all the work she put in, and before the birth, during the birth, and after the birth. She was the person who drove the mother home with a lasagna in her backseat.
Was it like $600 a year?
It was like $600. That's ridiculous. And so in Louisiana, they changed the law so that doulas can get paid, reimbursed for their service, and in New York. So I'm really happy about that. I'm overjoyed when my stories make a difference, and so I'm glad. And what I try to do is shine the light on what's going on, and then give people the tools to say, we want to do better.
So as I was talking to you before we started, is that everybody who knew your work, for years kept saying, Linda, you need to write this book, you need to do this book, and you weren't sure that it was necessary, and now that it's here, everybody's like, thank goodness. Why do you think, what was happening in your mind that you said, well, yeah, we need to know about this, but, I'm not doing the book, and then...
Well, it was really my editor. So with every article I write, she's like, this is a tangent, take this out. And then she said, save it for the book. And I said, I'm not writing a book. And then she did it again. And she's like, this is too much here, just save it for the book. And then I had so much stuff left over, I thought maybe I should write a book. I also realized that people were saying, we're taking your articles and using them in classes. We're using them in medical schools. We're using them in lectures we're doing at our agencies and our nonprofit organizations. And I thought, well, if they're using the articles, what if they had just all of them together plus more? So that's why, and I've been thinking about this, since the 80s. And thinking deeply, and with each story I do, I learn more. So I would have been done if it hadn't have been for the 1619 project. And then I thought, wait, in a book, I need to go back further. And so then it's like, and then COVID happened. It's like, oh no, I have to add COVID. So the book was actually supposed to be done about a year ago, but I got delayed with just, things happening.
Right. One of the many things, the 1619 Project. Talk to us briefly. You've written the medicine chapter in 1619. And I love the quote from the woman who says, this is how Black people get killed. Tell us that.
So that was Dr. Susan Moore, and she was not in the original 1619 essay, but I added it because this is the only place in the book where we explicitly talk about COVID. She was a Black woman physician in Indiana who got COVID. She went to the hospital. In the system where she was educated, she's a physician, and she knew what treatment, it was early on, but she knew what treatment she should be getting. And when she asked for it, they were like, no. And then she was in a lot of pain. I think it was her shoulder. And she asked for pain meds, and they said no. And they treated her as though she were drug seeking. So she ended up leaving that hospital because the treatment was so bad, but then she died. But before she passed away, she took a Facebook Live video of herself in the hospital, tubes in her mouth and in her nose, and said what was happening. And she said, this is how Black people get killed. And that video, especially after she passed away, lit a fire under people to say, wait a minute, this is unfair. She's a physician. And even a physician can't get the treatment she deserves. And the part that really hurt was after the hospital did a investigation of her case. What they came up with was that her medical knowledge intimidated some of the staff. And so that interfered with her care. And so if you know more, you don't get better treatment. If you're Black and a woman, was alarming. But it also sort of said, you cannot look away from this. You can't look away.
It was, just so moving because she could almost predict what her fate was going to be.
That's right.
Right. Incredible. Talk to us about clinical trials, because so much of what we know about medicine does not really include us. So I know that that's one of the things that you're interested in making sure that people participate in.
Clinical trials are tricky because of our history in the medical system. Many of us don't want to be involved in clinical trials, even sometimes when there's pay involved. And so that is the hard thing. But when we're not involved in clinical trials, some of the unique challenges or experiences we bring to the table get left out of the discussion. And so it's important that we're in clinical trials, but it's also important that those who are creating the trials acknowledge that we've been damaged by the healthcare system. So we will be reluctant to enter into a clinical trial, and the trust isn't always there.
Right. I know when doctors have asked, even me, would you like to participate? There's like, wait just a minute. So there's good cause for concern and reluctance, and the reason that the numbers are down in participation, but we need to do that. I was sitting next to a doctor recently at an event, and she's a kidney specialist, and we were talking about renal failure, for instance, which is astronomical. And she said during COVID, that is actually how many Black patients died because of renal failure.
And what is interesting about kidney, sad, is there's the EGFR is test for kidney function, and there's still a race correction on that. So if you're a Black person, you get a different reading than if you're a white person. And I was telling my editor that we were on a video call, and she's like, that cannot still be happening. So I held up my last physical exam, and it had circled Black patient, and it had a different reading. Certainly, there is no difference in, individuals cannot be judged by their race. And even medical students and some nephrologists are asking the question, how do you even know if a patient's Black? You have to say you are Black in order to get the different reading. And so something is wrong with the system that is still making sort of medical decision making based on the race you say you are.
Just incredible. And we only have, you have to come back because I could ask you, I already have asked you a million questions. I have a million more to ask you. But talk to us about the book cover, because that is capturing a lot of attention. And as you make it across the country and around the world, I'm sure doing this, people are going to ask you about, what drew you to this particular piece of artwork, which is extraordinary.
I love this artwork. It's a Black illustrator who I chose because of the paint on the skin. And I just thought, my book is about, the title is Under the Skin. So I wanted to say, show skin. And I love those scars, the scar on the neck, the little stitches on the ear, because it says, we've been wounded. We have been hurt by our society and our medical system. My mother is a bookseller for
of course.
many, many years,
right.
the Human Experience.
Books. Right.
And she said, always have a bright color with bold type, because they'll put your book in front of the bookstore. So I was like, okay, this is bold, this is bright. But I also think that skin on that really touches a nerve.
Are you working on another book?
Oh my goodness. Not yet, but I am thinking about what's next. But I'm very curious. When I go out on the road on book tours and to do signings, I try to listen as much as I speak so that I can have my ear to the ground and see what's going on and see what, where I can do the best good next.
The best good next. I love that. And
Trademark.
I know. What a great way to end. Linda Villarosa, thank you so much for being with us and for this book. I must say that, your personal story throughout, it makes it, ever more impactful. And thank you for your experiences and for being the great journalist that you are. And for, Under the Skin, which is a terrific book. That is it for us. Thanks for joining us. I'm Carol Jenkins. The program is Black America. We will see you soon. Don't forget to get Linda Villarosa's book, Under the Skin. We will see you the next time.